Now, the Nigeria Center for Disease Control and Prevention disclosed in its latest monthly situation report on cholera, covering epidemiological weeks 31 to 34, that the suspected cases and deaths of cholera decreased by 63 and 67% respectively, compared to what was reported at epidemiological week 34 in 2022. However, 210 new suspected cases of cholera infections and 10 suspected deaths have been recorded across 8 states of the country. Now, joining us to help us understand this further, we have Mr. Sebastian Yenan, the Incident Manager, National Cholera Technical Working Group Nigeria, the Center for Disease Control and Prevention in Abuja, Nigeria. Thank you so much for joining us.
Thank you for having me.
It's a pleasure to have you join us. Now, let's start by understanding why exactly do we have so much spread of so many disease outbreaks this period? Are we that susceptible?
Yeah, you see, you are also concerned with the fact that the issues around climate change is affecting the dynamics of traditional diseases that we have here. Lassa fever, meningitis, cholera, measles, and what have you. So most of these are actually linked to climate change. If not, disease like cholera actually is a disease associated with the rainy season. But we are beginning to see a shift where even in the dry season, cholera is being reported. So I would say the issues related to climate change is a factor. Then the issues related to infrastructures that are actually being overwhelmed now. Most likely, if you look at where these diseases are happening now, there is a humanitarian crisis in those areas, especially for the cholera. So a large human traffic go to where infrastructure actually cannot be able to contain. So this is also what we are seeing. Thank you.
Okay, now of the 8 states that reported 210 suspected cases, Zamfara State in the northwest topped the infection chart with about 190 cases. Why is this infection so prevalent in the north?
Yes, the issue of the north, like you say, the issue is around insecurity. Zamfara, for example, is already well known. Issues regarding insecurity has been affecting that state, precisely in local governments like Anka local government, Shinkafi, and Zumi local government. These are local governments that are highly insecure for now. And we, as I'm talking to you now, we have a very large cholera treatment center supported by Medicine Sans Frontières, MSF, in Anka local government, supporting the ongoing outbreak there. So people are leaving their homes to where there will be safety. And because of that, they are impacting on the available infrastructures that are there, whether it's for water, for sanitation, shelter, and what have you. So these are some of the indices that are manifesting there. The available capacity to cope with the influx of people is translated into these outbreaks that we are seeing, because access to potable water is a major factor here. Sanitation and hygiene, where you see people in IDPs or people actually stay with relations where the facilities to cater for their needs is highly deficient.
Okay.
But cholera is actually not new to most of the northern states, because if you look at population dynamics, the issues around water, sanitation, and hygiene, most of the infrastructures were there for a very long time. I'm talking about 30, 40 years now. So they need to actually be overhauled, where new technology should come in place for people to have access to safe water. So this is the discussion going on now, especially for states like Zamfara. We have to look at the capacity for the available water reservoirs to cater for the populace. Then the issue of the waterways, definitely there is need for overhauling. So these are the issues: climate change, insecurity, deficits in wash infrastructures.
Okay. Now, Mr. Yenan, we understand that this disease, like you said earlier, spreads through contaminated food and water, and it has reappeared periodically over the years. Isn't this a wake-up call for the government to do something about, especially, like you said, access to good water?
Yeah, the government has been doing something. We here at the Nigeria Center for Disease Control and Prevention have been constantly engaging with the colleagues at the subnational level. The DG of the NCDC actually avails himself with the opportunities presented at the Governors Forum. Then there are the periodic visits to states where we interface with them one-on-one. We show them the statistics and the areas that need to actually be addressed. Recently, we had our second joint external evaluation where all the health indices were X-ray, 19 thematic areas. So these are areas that there needs to be constant engagement with the subnational, the 36 state and the FCT, the 774 local government. They are at the receiving end. They are the operational level of what we are doing. So for global health security and especially national health security to be in place, this constant engagement has to continue. It has been happening, but you know, there are so many things happening where prioritization of needs actually differs between Abia State to Zamfara State. What are the fundings available? What are you prioritizing? Unless agencies like NCDC continue to engage, some of these priorities might not actually address critical issues now in the health sector. So we have been doing it, the state are trying their best, but we are saying they should do more because the issues related to cholera actually required huge investment in wash infrastructure.
Okay. Now, I would also like to ask, this disease that is spreading, is it very preventable? And if it is, how can we prevent it?
Cholera is a preventable and treatable disease, very preventable. The baseline is, first of all, to get your wash infrastructure right. Water, sanitation, and hygiene. These are the basics. When there is provision of these safety measures in the area of water, sanitation, and hygiene, the necessity is to continue to engage communities, sensitize them on the need to actually adhere to basic health indices of making sure you boil your water and cover it properly before use. You wash your food, especially raw food, before you eat. You cook your food properly and cover it before you eat. Then if you are actually suspecting, maybe through profuse watery diarrhea, that you are likely having a cholera, you present yourself to the available health facilities. We have them across all the countries. The nearest health facility most likely is 2 to 5 kilometers away from you. Why not avail yourself with this opportunity instead of going to be managing at the health center and in the community, in your household? Then we are now seeing cases of brought-in deaths. People present led to the health facility, which increased the mortality that is associated with that disease. So we continue to tell the communities through our healthcare workers and the community leaders and traditional and the religious leaders that this thing is preventable. Try to make sure people actually key into the campaign we are doing now. The country is moving towards open defecation-free communities by 2025. This is supported by partners. We are working towards getting that achieved. Most likely by that 2025, we are going to say, okay, this is the level we have reached. People have now been conscientized into the need to start using the toilet. So some of the major risk factors associated with this cholera actually is the issue of open defecation. So even if you have this water provided, cultural practices still encourage people to defecate openly and immediately runoff come because of the onset of the rains. It goes through the surface water, pollute whatever available water is in the community, and before you know it, contamination issues related to cholera are now being presented to the health facility. So is actually a very, very big issue that we need to look at the aspect of prevention first before management. So what are the strategies we are using? We continuously try to make sure that leadership and coordination is strengthened from the national down to the sub-national level. Everybody should know his responsibility. Whether you are a Director General of the Nigeria Center for Disease Control, the commissioner in the state, or the surveillance officer or a clinician in the health facility, you should know your roles and responsibility. Surveillance, we continue to strengthen it, is ongoing at the NCDC. The strategy is already a common strategy that we've been using, adapted from the WHO since 2002, integrated disease surveillance and response. As I'm talking to you now, there is a surveillance focal person at the health facility. We are moving towards community-based surveillance now in Nigeria. So this is to let you know that detection and reporting will be prompt. Immediately the notification is available. All other indices around case management will just take off immediately. So most of the time, detections are late. So we continue to strengthen capacity around surveillance to make sure that people actually present themselves early once it is detected that there's most likely cholera in the environment. Then other issues will be around the issues of risk communication, community engagement, and all other issues related to strengthening capacity in watch, which is supposed to have been done at the preventive level. Locally for us now in the country, there's another aspect to intervention for cholera, which is oral cholera vaccination. We have experimented with it since 2017, and it's ongoing now. The only thing is that the challenge is at the global level, the stockpile is actually very low. So we have plans to do preventive and reactive campaigns for cholera in Nigeria. However, the challenge, like I say, is access to the global stockpile, and we continue to discuss with the global level to make this vaccine available, which is a very good strategy now to intervene in the case of cholera. Oral cholera vaccine, potent, safe. Once it is available, which we have been using since 2017, we'll continue to make it in cholera hotspots. So what Nigeria has done now is we have been able to identify where are the cholera hotspots. Analysis is already available. The little resource we have, we can target it to this hotspot before we go to the larger community, which is a very good step we have taken in Nigeria.
Okay.
Then very soon we are going to also unveil the National Cholera Plan that will take us through a five-year course of action onwards to ending cholera by 2030.
Now, Mr. Yenan, you were talking about the cholera outbreak, and one of the things I would also like for us to talk about is the risk of death from cholera, which is higher when treatment is delayed. But with the current challenges that we're facing in Nigeria right now, although we have someone new to health, Dr. Ali Pate, who has assured that we will have better equipment going forward. But at this point, do we have enough equipment with the challenges that we're facing in the health sector to fight the cholera outbreak?
Equipment can not be said to be enough because the issues around adequacy will always be there because the population is increasing, conflicting needs are also coming forward, whether at the national, state, or local government level. So they can never be enough, but it's getting better. Now the issue is, what are you doing with the available resources? So that's what we're saying. With the little resources available, especially the health facilities, the cholera treatment centers, the cholera treatment units that are being established, we want people to know that they exist and they can provide basic services as simple as oral rehydration. Cholera is around dehydration. So the first point of actually treating cholera is to rehydrate the patient. And we are trying to make sure that we establish more cholera treatment centers and cholera treatment units that will be closer to the communities before the issues of referral can result in going to general hospitals and tertiary facilities. So it can never be enough, but we are trying to see that we get as much as we could, and we also try to utilize whatever is available, including sensitizing the communities to actually patronize. You see, some of these diseases like cholera still have setbacks of cultural practices where people believe that there is something spiritual about the disease, and that is why they present themselves led to health facility, and we are seeing mortalities increasing. So these are some of the things, behavioral change communication, that we are actually strengthening now.
All right, National Cholera Technical Working Group Minister, Nigeria Incident Manager, Mr. Sebastian Yenan, thank you so much for joining us to discuss the outbreak of cholera in Nigeria.
Thank you for having me.
All right, we're going back now to the Senate to find out the update on the situation from the breaking news that we brought to you sometime not too long ago. And we have our correspondent there, Amadine Uyi, who will be letting us in on the development. Amadine, thank you for joining us. Can you hear me?
I can hear you loud and clear.
All right, Amadine, what's the update now? We do understand that, we didn't know what happened, why he slumped, but what is the update now?
Okay, there is a medical facility within the Senate complex. And what happened, what we hear, information we hear is that he's been evacuated to the medical facility. But what happened was that they did not want the press to get visuals and pictures of him slumping. Remember, he had talked for almost 30 minutes where he was talking about his experience and the experience he was bringing on board. And at the moment, he began to thank the federal government for nominating him, the nominee from Kaduna State slum. He was not the first person who had made his presentation. We had a nominee earlier from Kwara State who had made his presentation, but he was the second person being screened by members of parliament before he slumped on the floor of the Senate.
Okay, Amadine, we also understand that the screening is on hold and there is a closed-door meeting going on right now. Do we expect a continuance?
Yes, it was because after he slumped, they did not want the press getting visuals of him on the floor. One or two lawmakers that were trying to get information who refused to speak just said that it was wrong for the press to get him on the floor of the Senate. So that was why they went into an executive session. But on the other paper, remember that about an hour ago, the Senate had changed its rules for the day, because according to the Senate rules, they were meant to stop plenary by 2 p.m. So the Senate had, a motion was moved and the Senate had extended the time so that they will be permitted within their rules to be able to end screening of the ministerial nominee. Also, on the other paper, it's not only the ministerial nominees that were supposed to be screened. Also, the Senate had on its plate to also screen nominees for the Niger Delta Development Commission. But we are hoping that the executive session will end and then they will commence with the screening exercise. They'll continue with the screening exercise.
All right, Amadine Oyi, thank you so much for the update on that. Of course, we'll be joining you subsequently so you can give us the update as it unfolds. Thank you once again for giving us the update. Anyway.